So today we are doing a very important topic, and this is a difficult topic. We are doing the education part 2, and in mainly we will be discussing the statistics topics today. So it is important part of the exam. In every other exam, you will see that there is one of the statistic communication scenario. It's common, and sometimes it come together like in multiple centers. But there is high possibility like it if it come in like two exams together, or it might come like after a few exams, so it just come up and it is like repeated scenario. It's a difficult and dry topic for everyone. I understand that, and it's difficult to grasp the concept, so we will try to clarify it today. So I will just start. Just the outline of our presentation today will be we'll be discussing about the audit, the clinical research, quality improvement project, evidence-based medicine, and governance. So I understand that this area is not very well written anywhere. So, but we will start and we will progress together and see how to do it in a communication scenario in a good way. But before we start, does anybody have any question regarding today's topic or any other topic, or they want to say anything? You can write in the chat box as well, and you can open your mic as well. Oh, all right. So, is anyone want to practice this topic, this scenario, communication scenario? This is a setting. You are a pediatric registrar inside room. Background information is Nasir is FY2, who has recently joined the pediatric team for next 8 weeks and expressed interest in participating in audit on the use of ORS in children with acute diarrhea. Nasser is unfamiliar with audit and has not had prior experience in this area. The task is to talk to Nasser about audit and answer any of his questions. Sorry, it's a typing mistake. So if you feel comfortable, I know that it's difficult and most of the people will not volunteer to practice today. So if you don't want to do this scenario, you can generally take it as a Nasser don't know anything about the audit, and you just give a overview. Not do it with example, just give an overview of the audit. What is audit? Do it as a teaching. Yeah, anybody want to practice? Or all of you are busy, or you feel that it's difficult topic and you don't want to practice it? So we can make it an open conversation. If you don't want to practice, like what is audit, what is your understanding about the audit, how the audit is carried out, what is the steps that are done in audit. Yes, that's good. Nagam, are you available to practice, or do you want just to? Yeah, yes, Nagam, that is very good. You can try. If you want to try with example, it's more than it will be good. But if you don't want to try with example, that's also okay.
Assalamu alaikum, Dr. Maimoona. Can you hear me?
Yes, walaikum salam. Yes, your voice is clear. How are you?
I'm fine.
Yeah. Okay, so you want to do it as a communication scenario, or you want to do it?
I think I can go for the practice, and then if any correction, you can make it from that.
Yeah, okay, fine. That's good.
Okay, so because I have exam on 16th November.
Sorry, when you're ready, let me know that I can put the timer on.
Just a minute.
Yeah. And if you want to do any drawing, you can also do that drawing
Okay.
and send it in the group if you want to do any.
Can I start, Dr. Maimoona?
Yes.
I'm just sending. I have made just the audit cycle in the picture. Okay.
Okay, okay. You are sending in the group, we can see from there.
I'm trying to send just.
You can send in the WhatsApp group or you can send in the chat here as well.
Okay.
Okay.
Okay, should I start?
Yes.
Hello, good afternoon, Nasra.
Hello, good afternoon.
I'm Dr. Nero, one of the pediatric registrar. You have seen me in your team.
Yes, doctor, I've seen you multiple times in the round.
Okay, so Nasra, how are you feeling coming to our pediatric team?
Yeah, doctor, I enjoy pediatric and I want to do it as my career as well. But I just want for my portfolio, I want to do some audit.
That's so good, Nasir. It's good to hear from you about that you are interested in audit. Let me tell you, if you want to have if you want someone else to be with you, if I discuss with you on this topic.
Yeah, doctor, everyone is busy. I think, yeah.
Okay, okay, Nasir. Let me tell you that. Do you know anything about audit?
No, doctor, this is the first time that I'm doing the audit and I don't know how to start.
Okay, okay. Let me tell you that about the audit that it's actually I would say that every unit has some protocols for the diseases and for the management. Okay, and in the audit we do compare the those standards with whatever we are practicing in our department. Okay.
Okay.
You know anything about what kind of procedure about that if we want to compare it with the standards?
Uh, n- yeah, doctor. No, doctor. I don't think about more about like I'm not done an audit before, but I decided like uh, somebody like some of my senior told that I can do an audit on the use of ORS in children in acute diarrhea, but I exactly don't know how to start and from where to start it.
Okay, that's good. Nasir, it's very good. And let me tell you that your senior has told you is a topic of the audit. It is one of the you can say it is one of the steps of the audit in which you will select the topic to be done. Okay.
Okay.
Okay, and let me tell you that in the audit we have 6 steps. Okay, and the first step is you have already done that. You have been given a topic about that. Okay,
Yes,
and
doctor.
other than that, then we will look for the standards and standards. What are the actual standards and what are the actual protocols that should be followed? Okay.
Okay, and doctor, how can we get that standards or protocols?
Yes, every unit has every unit and department has some guidelines and protocols for that. That are the standard protocols that are already written in the form that are already written with us. Okay,
Yeah, I got it. Okay.
and what do you think? What could be the other step?
I think to then collect the data, like how many children are
Yes,
coming to the area.
yes. It's so good, Nasir. You, it's that when we have chosen the topic, when we have looked for the standards, what are, and now we will collect the data about that how many children are visiting the hospital, and how many of them are getting the ORS, and how many of them are not getting the ORS. Okay,
Yeah.
that's so good. And meanwhile, you want to involve any other team member with you in this cycle?
Yeah, for the like maybe audit team or some.
Yes, to collect the data, you will need the help from your colleagues as well, from your staff, nursing staff working in the hospital, and you will involve all those people, and you will put your agenda, and you will tell them about that you are going for this audit. Okay.
Yeah, that is very helpful, doctor.
Yes, and after that, what we will further do is that after collecting the data, we compare the data with our standards. That how much we are following the standards. It's not that we might be following the 100% of that. Okay, then we will compare our data with that. Okay.
Yes.
And then the next step is we have already done the 4 steps, and now we have compared the data. And you know what's the purpose of this audit? That we want to make some changes in our setup to improve the quality of the care. Okay, and for this, what we changes we can propose and we can implement it in the hospital.
Okay, doctor.
Am I
Yeah.
clear to you?
Yeah, I have now some idea about the audit cycle. So, doctor, is this
That's
the
okay.
audit and quality improvement same or is different?
Nasir, that's so good that you. I'm very much happy that you asked this question because its quality improvement is not against the set standards. Its audit is against the set standards. Are you getting my point?
Yes, doctor. Yeah.
And quality improvement is a continuous cycle. We are going to improve the quality with every time. Audit that is time based. You can say that we can do it after 6 months and all that. We will first, what we have done the audit, we will implement and the changes, and then we further go for the re-audit. That is the 6th step of this. Okay, and if you look for the quality improvement, you can go, it is a continuous process. Are you getting my point?
Yes, doctor. So 3 minutes left. So, doctor, what is the importance of this audit cycle? Why do we do it?
Yes, yes, Nasir, it is very important things. It is good for the patient, and it has benefits for the patient and benefits for the doctors as well. Okay, for the patient that we can, as I told you that it's for the comparing the standard against the standards, and in this we will be better able to, you can say that implement the standards of our the hospital as well, and we can make the changes whatever needed for the benefit of the patient. And on the other hand, it can help the physicians to look and to go for the better patient care in the form of looking the mistakes if we are doing, or any improvement that we can do in the patient care. You got
Mm-hmm.
my point?
Yes, doctor. Now it's clear now.
Okay. Okay, Nasser, it seems so good that you are very much interested in carrying out this audit, and you have already given the topic for that. I will be always available to help you out in this. And you can, I have given so much information in the form of a big cycle and then telling about every step. Can you summarize it for me today, what we have discussed in today's meeting?
Yeah, doctor, we discuss about the audit, and there is a how the audit cycle and how we compare it against the set standards or the protocols of our department, and then how to collect the data and compare what we are doing with the department protocol. And yeah, and you also mentioned about the differences between the quality improvement project and the audit.
That's so good. That's us. You are here with us in the next 8 weeks, and I hope that you will be getting a good time in our team. And if you want to study some things and some important points further about that, you can use the library. For that, I will give you some important websites as well to look for and some websites to look for the researchers and audits. You can find there. And other than that, if you still want to discuss anything with me, I will be always available. And you can still ask me any question if you have any concern regarding that.
Yeah, doctor. Thank you.
Okay. Okay. I can arrange another, if you want, and I can arrange another meeting with you. And if you want your fellows to attend the session and to show your interest about audit to them and involve them, you can do this. Okay.
Yeah. Okay. Your time is up. So,
Thank you.
well done. You have done very good communication. How do you feel about the audit?
Um, Audit is the it's actually a time-based. I can say time-based uh, research. I can't say that. It's and to comparison of the standards with the whatever we are implementing.
Yeah, I mean to say, like, how do you feel after doing this communication? Do you feel comfort? Do you feel that you handled that well, or
I think for the benefits, I was a little bit confused.
okay?
That's what
Okay.
can be met.
So but you have a clear concept of the audit cycle and how the audit cycle is carried out, and then it was a very good that you draw the diagram, and then you can use the diagram that this is a cycle when you are explaining to the student. It gives them visual presentation, and it is easy for them to follow the steps as well. So that was very good. You were very systematic, and you explained. You didn't give too much explanation, and you didn't give too less explanation. So it was good. Overall, it was a good, and you managed to use the example. So you, for everyone, you can practice it in both ways, like without an example, and if this is it can come both ways in the exam, without an example and with an example. So sometime it is just like this Nasser want to know about the audit, and they will not give the example. Then you can always keep in your mind one example, and if there is no example in the scenario, you can use an example to explain. That will give a good impression. And sometimes they will give any example, and then you can explain on it. But if you have a basic understanding, then it is easy to fit the example within this cycle and how it will be carried out. So there are two questions that I didn't ask you, Nagam, because the topic here, Nasser have already selected. But there is one question, like if the topic is not in mind, then the student can also ask you, how do I select a topic for audit? Then what can you say about that? Or anybody else can also answer.
For that, I can say them. You can find it according to as per your rotation. What you think that in whatever we are doing in the hospital, you want to know about that, or anything like that. I can say that hand washing technique, how the people are doing this, or how the patient is coming to the hospital and managed. Any kind of topic you can select from that, or you can discuss with your senior as well.
Yeah. So yeah, okay. So any other thoughts anybody can say, like how to select the audit topic? Because if the topic is not selected, then and student want to ask you.
We can say while doing your rotation, if you think there's anything that needs to be improved,
Yes.
and you think there's something you can do about it, then you can perform an audit.
Yes. So both of you are right. Thank you for answering. So usually the question that come from the patient complaints, like you can, or there is some incident report or problems in the clinical practice. So usually we want to improve something that is problematic. Like there is uh, patient is not happy, or suppose in this case, like if we are giving ORS, but most of the children with acute diarrhea, they are representing in the ED, or they are with dehydration. So this means that there is a problem in this area. So usually it is identified from the patient complaint, incident reports in the clinical practices, and we can also tell them that, as you mentioned, that when you work here, you will identify the area that need to be improved, and then you can do audit on any of the topic. So well done. So I will just discuss about this audit cycle and what is audit. So maybe starting before audit cycle, you just give an ask the medical student what is audit, and then if they don't know, then just tell that it is a quality improvement process enhancing and at enhancing patient care and outcome through certain steps. So if you memorize this definition, then it will be good. So and then you can come to the cycle and talk about the cycle. So there are 6 steps, as you mentioned, in the cycle. I think we didn't discuss about the re-audit, but identify the issue. So you identify the issue, as we mentioned, that it is usually from the patient complaint or from the.
And can we have the previous slide just for a second?
Yes, why not?
Yeah, ma'am.
Okay. So identify the issue. We discuss about this, and I will discuss this each in detail. But I just want to show you this audit cycle. The second is obtain or define a standard. Third is about to collect the data. Fourth is compare the performance with standard. Fifth is implement the change, and sixth is re-audit. So let's talk about one by one. Okay. So identify the issue. So this is the example. Sorry. So like you can give any example in your mind, like inadequate hand hygiene. If you are getting, like you are noting the rate of infection is increasing, you get a complaint, or if more of the children are representing in the ED with dehydration. So let's say there are 2 examples. You can use any example, or sometimes they can give you example. Like here we use an example like inadequate hand hygiene or improving the hand hygiene compliance, right? And the other is use of ORS in children with diarrhea. So how to choose the topic, identify the issue. So the audit topic that you choose should be SMART. That means if you use this mnemonic, SMART means that it should be specific, specific problem. There should be specific problem, yeah, and then it should be measurable. It should be something that you can compare against the standard, and you can evidence that improvement. Then A is for achievable. It means that it is not something that is you are doing something very rare thing. So do it on the common things that you can achieve your targets. Like if you do something very rare and that's not happening very frequently, it will not help. But if you are doing something that is very common, that it means it is achievable. Then and R is for realistic. Realistic mean that it is relevant to your aims. What are your aims? You are able to achieve them or not. And T is for timely, like you have a timeline for that project and you want to achieve that. So usually what in our NHS we identify these like audit topics from the incident meetings. Like if you attend an incident meeting and then you can identify, yeah, this is the area, this needs improvement, and then you can choose any topic. But this is the way, like any topic that you want to be choose should be smart. Then you can explain about this mnemonic and they can proceed it. So coming to the second step, then for example, we are using here the use of ORS in acute diarrhea. So obtain the standards. So standards are the protocols. They can be NICE guidelines. They can be local hospital guidelines, as you mentioned. And so obtain some standards. What is the standard? So let's say in this example, we make some standard. It is not important that you mention each the same standard in the exam. It's just for an example, like but you obtain some standards. So for every child, it means that for every child, you are evaluating the extent of the dehydration. Then standard 2 is that you categorize them into mild, moderate, and severe. Standard 3 is if they are mildly dehydrated, send them home only if they pass the oral challenge test. Standard 4 is instruct the mother how to properly dilute the ORS. And standard 5 is educate the mother on recognizing the red flag indicators and when to come back to the hospital. Now, these are the standards that we follow before sending the child from ED to home if they pass the oral challenge test. Let's say I just take a one standard. Okay, so now the second step is data collection. So we can collect the data either by a simple performa. So you can make it from the hand filled, like data can be entered by the hand, like you make a performa and you fill this data just by hand, or you can do it on the electronic medical record as well. So let's say, like I have shown you four standards. For each standard, then you make a questionnaire. Like let's say for standard 1, we make a question like to assess the degree of the dehydration, and then you go and assess whether when you collect the data, you see are we assessing the skin turgor, the level of activity, sunken eyes, like are we assessing the degree of dehydration? So you can just put a tick or cross, yes or no, you can tick or no, and then you can see, suppose against the standard, another standard, let's say I take the standard like the child has passed the oral challenge test or not. So you can make a criteria yes or no. So and so for every standard you collect the data against it. This is the data collection. Then we compare it with the standard. So suppose our policy, hospital policy is that we follow the standard in 90% of the patient at least. But when we analyze our data, let's say it come out to be 60%. So there are areas for improvement. Yeah, so that you identify the area, what are the weak areas. Maybe the health professionals that are involved need to be trained, like they are not assessing the degree of dehydration, they don't know, they're not aware of it, or they are not doing it, they are not counseling the mother properly how to dilute, or they are not giving enough time for the child to stay in the ED. So it should be like 4 hours to give the oral fluid if they're mildly dehydrated and they pass the oral challenge test, and then they can be sent home. So either they're, because of the pressure of the more patients, or patient load, you are sending them early without keeping them 4 hours. So what is the reason? So you identify the areas that need to be improved. Either this is lack of awareness, you can then educate the